Wonderful. Welcome everyone to the webinar series for the Child Early and Forced Marriage subgroup of the Gender and COVID-19 Working Group. So we're delighted today to have colleagues from Oxfam Novib speaking regarding a recently published report on short-term impacts of COVID-19 on adolescent girls and young women in Pakistan, with some indicator, I believe, or indicators on child early and forced marriage. So welcome, we're delighted to have you.
Yeah, thanks. Many thanks for having us and for inviting us to join this meeting today. We're really happy that you give us the platform to share and discuss our research. So my name is Marike Meeske. I'm working at Oxfam Novib in the Netherlands. And I'm working as an impact measurement specialist. And I'm joined by 3 colleagues from Oxfam Novib, who can each introduce themselves, I think.
Shall I go? Hello, everybody. My name is Francisco Bolaños, and I work together with Marike and with Karen in the impact measurement team in Oxfam Novib. I'm also an impact measurement specialist, and with Marike we work together on these reports about the short-term impacts of COVID-19 on young women and girls.
Hi everyone, I'm Karen van Zaal, also an impact measurement specialist, same as Marike and Francisco. Also in the same team, IMK, Impact Measurement and Knowledge within Oxfam Novib. And together with Ronald, Marike, Francisco, other colleagues in The Hague, but also in Pakistan, working on the Marriage No Child's Play project, which has also ended now. So I think Ronald will tell you a little bit more about that one later. So over to you, Ronald, introducing yourself.
Thanks, Karen. And hi, everyone. Good to be here. And I'm the project lead for the Marriage No Child's Play program on behalf of Oxfam Novib. And yeah, excited for today's session.
Thank you. I'm going to share my screen. Can you see it?
It's working.
Yes, yeah.
Perfect. Okay, well, yeah, so we need hopefully around 15 minutes or so to introduce you to the research that we did about the short-term impact of the COVID-19 pandemic on women and girls in Pakistan. And after that, we have plenty of time to have a discussion about it. But first, Ronald, you are going to introduce a bit about the project that we did. And then we move on to the results about the research. So the floor is yours, Ronald.
Yeah, thanks so much. Yeah, I'm going to speak to max 3 minutes about the project, just to give you a bit of a background of what it was all about. And then we're going to focus in, of course, on the COVID-19 research. But briefly, the Marriage No Child's Play project, it was part of the More Than Brides Alliance, which is an alliance between Save the Children Netherlands, which is the lead organization, Oxfam Novib, CIMAVI, and the Population Council. It was a 5-year program, and it actually just ended in December 2020. So we're just in the wrap-up phase till now. And it was in 5 countries: India, Pakistan, Malawi, Mali, and Niger. And today, of course, we're going to focus in on Pakistan, and specifically on Sindh and Punjab, 2 provinces. And for those who are familiar with Pakistan, you will know that these 2 provinces are really big. So in those 2 provinces, we focus as a program on 2 districts, which is a bit in the south of Punjab and in the interior Sindh. So it's quite close to each other. The project, as you can see in the bullet points at the end of this slide, it was all focused on empowering girls and young people to realize their sexual reproductive health and rights. That was the main ambition, and in that also ending and diminishing child marriage practices. We focus in a sense on 3 key pathways that are summarized in a sense in these 5 bullet points that you see at the end. But in general, the 3 pathways that we had was that we focus on girls' voices. So developing life skills, setting up girls groups, youth groups, really like the empowerment, the confidence of young people themselves. Then as a second pathway, it was all about alternative pathways. Think about education, economic opportunities, so all the alternatives for girls instead of child marriage. And as a third pathway, it was all about shifting social norms and policies to prevent child marriage and to empower young people. And that includes, for example, also setting up joint action with young people and communities against child marriage. Go to the next slide, please. And then when it comes to COVID-19, so the pandemic in terms of our program, it hit in the last year of the project. Many program activities actually came to a halt because of it. Of course, there were many big limitations and of course refocus because of all the urgencies that arise. And in terms of like the adaptation, so many activities halted, but also the project, the local partners, Oxfam country offices, they adapted to the COVID-19 pandemic and responded to it. And in a sense, looking at the project theme of sexual reproductive health and child marriage, there were 5 key themes that were linked to the gendered impact of COVID-19 that the project started to focus on, which is the impact of COVID-19 on child marriage, increased school dropouts, increase in domestic violence faced by young women and girls, reinforcement of the patriarchy. Any social norms changes were under pressure in terms of reverting back because of the pandemic, and increased cases of child abuse. And 3 key or like main strategies were implemented to address these topics. First were discussion with communities to really like lay out, okay, these can be the gendered impact of COVID-19. You can think about like approach through social media, awareness raising sessions in communities when it was possible according to new COVID-19 guidelines in terms of safety, sharing informative pictures and videos through WhatsApp, for example. And the second one was using and working with those young people in the youth groups and the girls clubs that were set up. Really effective entry point in terms of disseminating messages to young people, using their own phones or, for example, in the case of many young girls, like phones of family members. Not always the internet access is unfortunately there. And lastly, also very interesting, there was a campaign used on rickshaws to spread COVID-19 messages, and also wall murals were painted to reach community members without access to technology, for example. That is in a nutshell the project and how COVID-19 impacted and how we responded to it. And yeah, over to you, Marika and Francisco, to the research.
Thank you. We wanted to better understand what are the short-term impacts of the COVID-19 pandemic on women and girls in Pakistan. And basically, we identified 5 priority outcome areas, which include education, unpaid care work, the perceived risk of gender-based violence, the perceived risk of being married off, and mental health stress. And what we wanted to do was analyze which groups of girls are likely to be hit harder by the pandemic on each of these 5 outcome indicators. And we also assessed whether girls participating in the Marriage No Child Play project and girls not participating in the project, whether they were impacted in the short term in a different way. And the methodology basically has 2 components. The first component was a literature review, where we identified characteristics that might explain a differentiated impact between different types of girls, so to say. And then we did a quantitative analysis in which we tested these assumptions. So we tested what characteristics of girls might influence the impact on their education, unpaid care work, the 5 outcome areas that I mentioned before. And data that we used was from the endline survey of the Marriage No Child Play project, which was collected in November last year. In the districts and provinces that Ronald mentioned in Sindh and Punjab in Pakistan. And we interviewed close to 1,000 girls. And the estimation method that we used was multivariate analysis, regression and probit models. We included a bunch of covariates. You can read them on the screen, but maybe one to elaborate on is the child marriage indicator, which basically is the an indicator for the age of marriage, the difference between the age of marriage and the legal age of marriage. So if the girl was married at her 18th, the indicator equaled 0. But if she was married at the age of 15, then, for instance, this indicator equaled 3, because the difference between the age and the legal age of marriage was 3 years. Yeah, let me move to the main findings. So we have these 5 outcome areas, and in the short term, the largest impact of the pandemic was on the area of mental health stress. So around 90% of the girls indicated at least some form of mental health stress, which is quite a lot. And then for a smaller percentage of girls, we found negative impact on school attendance, roughly 15%, an increase in unpaid care work responsibilities for roughly 1 in 4 girls, and the risk of GBV, the perceived risk of GBV increased for around 1/3 of the sample, and the perceived risk of being married off also increased for 1 in 3 girls. And that might be relevant to mention, especially in this working group, because you focus on child marriage. So this covariate on child marriage was not significant in all of the outcome models, and that so that indicates that we didn't at least find a significant relation between a girl that was actually married before her 18th and the negative impact in these 5 outcome areas. We discussed a bit about it. It may be because that is mediated by other factors included in the model. So, for example, there's also a relationship between the child marriage indicator and the actual age of the girl when she participated in the survey. So it could be that is explaining the why we didn't find a relation there, but we don't know for sure. Then the short-term impacts of the pandemic, they were similar for the girls participating and for the girls not participating in the project. And lastly, a key finding is that really the short-term impacts are different for different groups of girls. So this is also feeding into a future program recommendation that really diverse group of girls cannot be treated in a homogeneous ways because the pandemic impacts them in different ways. For this presentation, I want to highlight a bit the results for the indicators on gender-based violence and risk of being married off, and then we can conclude. So we asked girls to respond to the statement, women and girls are at increased risk of violence during the COVID-19 lockdown. So this is really a perception type of question. And 1 out of 3 girls, they actually perceive that indeed women and girls are at increased risk of violence during the lockdown. And we found a positive significant relation between this perceived risk and their absence of parents at home. So if parents were away from home more days, then more girls perceived then a risk of gender-based violence. And we discussed it a bit with the partners, and one possible reason could be that girls, they value the presence of their parents at home as a source of protection. So that's one reason what could explain this result. And then we also found that girls who feel better able to voice their needs, concerns, and interests when it comes to decisions about their work, they are also more likely to perceive an increased risk of GBV during the lockdown. And one possible explanation could be that these girls who are more economically empowered in that sense might be perceived as a threat by other household members, which might explain this positive relationship that we found.
Sorry, can I ask a question?
Yeah, sure.
Did you measure GBV?
Actual exposure, do you mean?
Yeah, actual violence rather than perceptions, because those can be quite different.
Yeah, no, that's a good question. So this statement really was about the perception, and so it could be interpreted in different ways. That intention was that it was about perception, but we don't know for sure, of course, if girls interpreted it for their own exposure. If I remember correctly, we didn't ask about actual exposure, but Karen, maybe you remember.
No, indeed, we asked about the perception of GBV and not actual GBV, because in the sample we also surveyed quite young girls. So it's we were also quite sensitive about asking certain questions and go and into which detail are you going with them regarding questions on GBV on the one hand, and on the other hand, what would you like to know as a researcher or as a program implementer, and then weighing those two factors out. Hope that's an answer to your question.
It is, thank you. I just wonder if people who are more proactive, more educated, may be more likely to perceive certain actions as non-normative in GBV, whereas other people who are living in the same environment may not perceive that. So I don't know that this is a reflection of differences in GBV rather than perceptions, which I think is an interesting,
that's also
an interesting comparison. So I just wanted to clarify.
Yeah, it's also interesting comment that you're making, because indeed you often see, right, that in projects that have either a GBV focus or a component, that in time when people are getting more, for example, training on what GBV could be, or maybe more knowledge, or their attitude is changed towards what type of actions they are experiencing or could experience is actually GBV, because sometimes it's, you don't know, right? And then we often see that in those projects or in those cases, you see that GBV seems to increase, but on the other hand, is it GBV that's increasing, or the awareness of people that what GBV is? So I think that it indeed could also relate to your question. Indeed, that is in what way. In what way do the findings still hold if you also compare it to certain educational level, for example, or if we could maybe relate it to a certain proxy around if girls are maybe participating in the project for a certain year, so then you're assuming that if they have been part of the project for a few years, that they probably have received information about GBV, and then I'm looking at and Marike and Francisco say have been working on the analysis, but could that be maybe things to look at, or have you looked at it maybe?
Yes, so on education, like and other socio-demographic variables, we did include that as covariates, and if I remember correctly, they weren't significant, at least not for this this variable. Yeah, but we did try to at least control for more the socio-demographic characteristics. But of course, it all influences your perception. Yeah.
I also think. Sorry, please.
No, go ahead.
Because I think indeed the part of the education, it has a point. At least in our sample, like we didn't find like a significant relationship, but I think what is interesting in this part is, and it may be maybe also somehow connected to that, is that we found that when girls feel that they're better able to voice their needs, at least in relation to work, which is one type of indicator of voice and empowerment that we had during the analysis, then we saw that they were more likely to perceive an increased risk. So in that sense, what we believe it is that, a higher sense of voice, then I think it plays a more important role to be more conscious about these risks.
Yeah, and I think this is a really interesting discussion. I think moving forward, also asking a question that is that takes the interpretation out a bit of what violence is, and asks instead, like, do you think women and girls are being hit or punched more often? Do you think they're sort of trying to ask the question in these very sort of hard outcome ways can help take some of the interpretation out? It won't quite get there, obviously. We'll still have some of these issues, but it's just interesting to think about. And I do think perceptions are also really important on their own. They're just a slightly different concept.
Oh yeah, I agree. And thanks for the suggestion. I agree. Yeah, I have one more indicator that I want to present is again a perception statement that is about whether women and girls are at increased risk of being married off during the lockdown. And then again, 1 in 3 girls, they agreed that women and girls are at increased risk of being married off. And there was a correlation also between the girls that agreed to this statement and the previous one about gender-based violence. And here, I think this relates to the discussion that we were just having. So again, girls who feel they can voice their needs, concerns, and interests regarding their decision about their marriage, this time they were more likely to perceive increased risks of being married off during the lockdown. And we also discussed that this, this might relate to the level of awareness that they have about, potential risks. And again, we found a positive relation to the absence of parents at home. So we discussed that a potential explanation could be that girls of whom the parents are at home, away from home a lot, that they have work where they have to make long days or more precarious jobs, and that these girls could potentially that they are worried that maybe their economic situation of their household might worsen, and that this also has implication for their risk of being married off. But it's a bit guesswork there, but that was a possible explanation we thought about.
Marika,
yeah.
Sorry. I find the data interesting. You have 900 plus girls, and it sounds like you had some baseline data for these girls too, right? So were you able to look at changes in some variables that were the same, that weren't necessarily asking a question about COVID, but would reflect, how long ago did you do the baseline?
Baseline was in 2015, if I remember correctly.
Okay. So, some of the girls, they're different ages, but if you sort of looked at some of the girls who would have been 20 to 24 then or whatever, and are in the cohort of girls who are 20 to 24 now, slightly different cohorts, but presumably representative of the same group. Are there some questions about, do you think you're going to get married in the next 3 years? Or did you get married in the last year, that can more objectively look at, and I see midline, that can look at changes and actually changes in the risk of being married off?
Yeah, so that was so this study is really, we only used the endline data of the project, in which we added a few COVID questions to really put a focus on COVID. But we also did an evaluation report which includes both baseline, midline, and endline data, and then we focus more on the indicators that you mentioned. So also the percentage of girls in the sample that were married, but also married before 18 years old. And we actually saw a decline there, and which was steeper for the girls participating in the project compared to the girls not participating. Karen, you unmuted yourself, so I thought you wanted to add something.
No, I'm listening to you. Yeah.
So we could share the link to that report too. And there we really focus more on trends over time. Yeah.
I'm also thinking of your comment, Rachel, to look at the two cohorts, like looking at that question between baseline and endline. Even like we saw a decrease in the amount of girls getting married, and also we have some questions on that are, I'm just thinking out loud, brainstorming at the same time, but in sort of yeah, would it? Yeah, no, sorry. I'm just letting it sink in my mind and just ignore my unmuting for now. Sorry.
Yeah, and it may not be possible, depending on when the Endline survey was, to get, indicators that were relevant just during the pandemic. If there's this big downward slope in child marriage, to figure out how many actually got married during the pandemic versus the same time period the year before or something. I don't know what your data look like unless you know when exactly they got married. It may totally not be possible. I was just curious because you have such rich data, it sounds like.
Yeah, indeed. I was thinking like, oh yes, on the one hand, the data sample is really large, but on the other hand, that if we're looking for that effect, it might be too small again, right? Because the amount of girls getting married in that time span might be too small than to really be able to have like enough power to see to see an effect or so, or to at least look into the data. But it is really it's good to also reflect on it and share your thinking. You never know what kind of new ideas and you can generate and new ways of looking into the data sets.
Yeah, you might absolutely be right that the number of girls getting married during the pandemic may be too small to really compare. But if you see a trend that's going in a similar direction for dropping out of school, getting married earlier, experiencing a little more GBV, whatever it is in the last 6 months of 2020. And again, I'm not sure you can do that, but it would be really interesting. But you're right, it may be much too small.
I think and I think also like one of the discussions that we have also that it's about, okay, what type of impacts we can see now. And then one of the reasons why we decided to name it as short term is because we were aware that maybe in this moment, what we will see is like a picture of a period of a few months after the pandemic. But indeed, I also guess that as the pandemic continues and new lockdowns are also happening again in different countries, I guess that maybe only after, like probably this year or next year or after more years, then we will see the final effect of the pandemic, which probably is going to be like much larger than we can see now in this moment with this study.
Yeah, I agree. Do you have plans to do another survey round with these same girls, or does Endline imply you're done with this particular study?
Yeah, unfortunately, the project ended. So we're the project ended, and we're not able to do another round of an Endline. But I think it's also like another end line or post Endline. But I think it is if as like being in this world of implementing project for a certain group of people, then on the other hand you would also like to know what is like the longer effect of your programs being implemented in certain areas, or of people being receiving trainings or other type of support. I think that is the question that is that's also super relevant, but unfortunately in this case probably not possible to look at.
I think I have one final slide. Yeah. So based on the results that we had, we formulated a few recommendations, and so clearly the pandemic has different impact on different types of girls. We also saw that for the different outcome indicators that I skipped for the sake of time. So one recommendation is that programs should really focus or should be sensitive on to the diversity among girls and the different impacts that that it could have on different girls, so that interventions could be tailored to subgroups. Then another recommendation that programs should that have a focus on GBV could consider a focus also on the girls whose parents are absent from home, because we saw this significant relation between the two. Also, that programs should be mindful that empowerment can work in different ways on girls. So on the one hand, we saw, or I didn't present it, but there was a positive relation to the between the empowerment of girls and their ability to stay in school during COVID. But also that the risk of GBV, for example, or the perceived risk of GBV increased. So it could work in different directions. And lastly, so mental health stress was really the biggest. Was impacted the biggest by the pandemic. So this is also something to keep in mind, because it potentially could evolve into long-term impacts if it's not addressed adequately.
Marika, sorry.
Yeah.
I'm sorry, I keep asking questions.
No, that's good. Yeah.
But I actually think that third point is really interesting. Girls who were more empowered could affect their decision to stay in school, and actually stayed in school, which is related to, child marriage, but also a host of other economic and health outcomes across the life course. That's actually a really big finding, I think, about empowerment. And I'd be curious if empowerment, either directly or indirectly because of school, also was related to less mental health stress. To me, that seems like a very important finding and a paper of interest to many people.
Yeah, I agree. I'm thinking now whether we found a relation between empowerment and education on mental health stress, but I don't remember. Francisco, do you know?
I think I was mute. Let me check. No, actually not with empowerment, no.
Yeah, and I think side note to this finding on education was that so we did find this positive relation, but the sample was also the sample of girls that were actually going to school before the pandemic was quite low. So I think in total, like 15% of the girls attending school before COVID were no longer attending school during the lockdown. And we actually expected a higher percentage, but also we thought because the school attendance was already very low. We have some sample size considerations there too, I think. So this was the presentation. We can share the link. I think it was attached to the email, so you have it already. And I stopped sharing for now, but we can continue our discussion.
I also see a question of Sushmita for you, Marika, in the chat box.
Yeah, hi. Many thanks, Marika and the team, for doing this fabulous presentation. And I was very much engrossed in listening. And thanks, Rachel, for also putting your questions, which are very pertinent. And I would like to put forward certain questions, and which may take us back to I would like to understand that if the age group was 15 to 24, how did you decipher or break down the concept of violence? I think Rachel also tried to ask a similar thing. I'm really trying to understand that. Did you try to understand that what is the level of understanding among the girls, if not COVID, because you have the baseline and the midline and the end line? In the three things, how have the girls envisioned violence? And I'm really interested to know that when it is locked down, and I think I'm just assuming what is lockdown. Like, for example, in India, lockdown meant I was completely inside the house, and that's where. So if the girls are responding that there is more risk whether the parents are there or not there. So what is the kind of violence that is the girls were actually perceiving? And was it like, so-called physical and this violence, or more of mental violence or something like that? I think I'm really interested that how the girls understood violence and responded to that.
I think I have to disappoint you a little bit, because we asked the question in a very general sense. So we asked about violence, and then we mentioned different places, but we didn't specifically ask about physical violence or mental sexual violence. We just meant violence, which indeed also could mean that different girls have or interpreted it in different ways, or actually identified some types of violence as violence, but others might not have identified that as violence. Francisco, you want to add?
Oh, I think that is indeed something that a lesson that we learn, and thanks also for pointing out that, because I think we are also planning with new impact evaluations that are coming to also include additional, let's say, a set of questions about COVID, and then now we are already like discussing, okay, we need to improve these type of measurements, because we need to be very specific about the type of violence and how people interpreted this and where and when. I think in this case, what was the time period of the lockdown in Pakistan? I can't remember exactly.
I think it started April. But to be honest, I have to look into the report again because I forgot.
I think it was April till June.
Yeah, it was
Yeah,
around
April
that
to
time,
June.
March, April, yes. So I'm just trying to understand, because I'm from India and we are all similar context, but little maybe different cultural backgrounds between the two countries. I'm more curious to understand the concept of absence and the presence of parents in deciding about their marriage. To be telling you, in India, for example, we feel that, okay, there can be many other relatives who might be pressurizing the parents to take a decision, to take action for the marriage of the girl, eligible girl, but not really getting her married when the parents are alive. They are just locked down somewhere else because the transports and the mobility has been administratively stopped, and that is the case. So that's a real learning for me. I'm really learning that other family members also take a decision. So your recommendation on really designing some strategies to work with such context or such cases of parental absence from the household, or the parental support, physical presence of the parents with the daughters is a big learning for me. Maybe
May
I would like
add
to ask.
something about this one.
Yes.
Okay, I don't know in this setting in particular, but I understand that in other settings, one way that this may happen is that with the absence of the parents, there may be a higher likelihood of sexual violence or sexual abuse against the girls. And then also in some settings, what has been shown is that with the pregnancy, then there is kind of, in order to, for various reasons, that it may be followed by an early marriage. So this may also be a consideration.
Yeah, good. And I would like to also understand, did you find any difference in terms of 15 to 24, minor and major legally, and did you find any other difference? And also I would like to ask that, given that your program was running for a couple of years before COVID, did you find, or what would be a recommendation? We are all in the same boat and we are trying to understand that how we should improvise our agency building efforts with the girls so that they can face such crisis, such pandemic situations in future as well. So what would be your recommendations for improvising on the life skills programming?
So,
Yeah.
oh, sorry, Francisco, go ahead.
Yeah. Can I maybe answer to your first question about age? In the research, actually, we only found differences, or let's say impacts in relation to mental health stress and in relation to unpaid care work. So we didn't discuss in the presentation this in detail, so that's maybe why it didn't appear. But for example, in the case of mental stress, what we found, it was that older girls, they felt more stressed than the younger ones. And yeah, we have there several hypotheses. We don't know exactly the reason why, but we think, okay, maybe they are also more conscious about the situation, but at the same time, they also probably they feel that their networks at school are also more important. Their peers, they also may be transitioning to the labor market. So there are let's say additional sources of stress for the older girls. So the COVID-19 also like increased that, I think. But this is like an hypothesis that we had to try to understand why we found this. And in the relation to unpaid care work, because we also asked about if the girls perceive an increase in the unpaid care work that they were doing at home. And in this case, what we found that the younger girls perceive an increase in the unpaid care work that they were doing at home. And then we believe that maybe before some of them they were attending school, or maybe they could do other activities. Maybe they didn't were used to be at home for that long, maybe, and now they were burdened with this additional unpaid care work. Sorry. And that maybe older girls, they were more conscious about that they were already doing this. So maybe they didn't perceive a large increase, or that's what we think why we found this type of results.
Perhaps I can go into your second question, Sushmita, on the life skills and what works and what we've seen now also with the COVID-19. I think what became clear with COVID-19, for sure, like the fragility of it all in terms of like the results that you have and like how easy also it can revert back. We've seen directly the impact of the life skills and the empowerment of young people, but also with COVID-19, the risks of, for example, like losing that access to education, losing, for example, being able to meet up with, for example, youth groups, or actually like enjoying the empowerment that has been created over the course of time. And I think an important lesson learned was that social norms change takes time. That is not like a big new lesson now. That's, I think, widely known, but I think investing from the start and really taking men and boys also with us in that journey in terms of changing norms in communities and really trying to create that space for girls and for youth in more general. I think that is really key. And it comes also now in play again with COVID-19. It's really what we see, like it's so easy for norms to regress back and from things to go back to like the way it was always done, or for example, like girls to drop out first out of school. So I think the more we work on that from the start and make that really like a change together with communities, and at the same time also like empower girls through life skills, but also set up like sustainable youth groups, the better like these kind of shocks to the system do not regress back to the way it was. And we've seen also, for example, the youth groups that were set up really playing a key role in still, for example, young people being connected to each other, sometimes through digital means, sometimes through face-to-face whenever it was possible. So I think those two lessons, like the importance of like really setting up sustainable youth groups, really as one of the answers. And social norms change, that really is important in terms of like the results of girls being empowered, being able to act upon it. And the more we invest in that from the beginning, the better also, of course, that change can take place and can sustainably be there.
Yeah. Thank you, Ronald, for that. Just curious, did you find any challenge in reaching out to your respondents due to lack of digital device access to the girls? How did you overcome that? Could you share a little bit more about your data collection experience?
Yeah, sure. So actually the data was collected on paper, and that has to do mainly with security reasons and agreement or the MOU with the government, I think. Karen knows more details about that.
Yeah, we in the first year we normally in our research team within Oxfam we try to work digitally as much as possible. So use phone-based surveys to minimize the error, the human error in the surveys. This is also the method we used in the baseline, but for midline and endline, this was not possible due to some the agreements with the government. So we used a paper-based survey, but had a whole system built in where we double checked, so double entry of the survey and then checking whether there's an error and going back and going forth. So it was quite a diligent process. Of course, there are always some errors in it, but and yeah, mainly most of the errors were taking out. Yeah, definitely.
Great. Generally nowadays with lockdown and COVID, we are hearing telephonic surveys.
Yeah.
So, great. Yeah, thank you.
Yeah, we had the end line was implemented after the first lockdown in Pakistan, and in the areas where the project was implemented, the cases of the coronavirus at least at that time they were not prominent, or not there were no cases. So we discussed with our colleagues and partners, okay, is it possible, is it safe? There was a protocol on corona and the COVID-19 to maintain distance, have masks, sanitizers, really to ensure people are really safe. And yeah, but indeed, that's what's happening more and more right now with the phone surveys, or have different type of methods, or just use the data that you might already have in your on your hard drives. Yeah.
Great. I'm just curious, if I can ask, beyond the project question, that these are all very interesting findings. Are you talking to government with these findings, or how are you giving it back to the community? What's your plan there?
I think that maybe Ronald, you can say a little bit more about the lobby and advocacy part of the project, how we're using the findings.
Yeah, exactly. I think it's twofold indeed. It's lobby with governments at various levels, mostly the district level and the provincial level. And also the findings are always fed back into the community as well. So there was like an end of project visit to the community to feedback in more like user-friendly ways, the findings of the various research that we have done. And also similarly, there is as really part of the project, there was a big lobby and advocacy trail in which we've worked with various district level authorities and provincial level authorities in terms of setting up, for example, like district monitoring committees around child marriage. And many of the program results actually find their place in that. For example, the monitoring committee set up, they are still running after the program is ended. And the same actually for I'm not sure what it's called, but it's like a group of teachers, like a school board, something along those terms. But that was interestingly enough also set up, and we saw that directly continue during actually the COVID-19 pandemic. So like a group of teachers were like voluntarily providing life skills to young people in school, out of school. And it actually continued during COVID while the program itself actually was inactive. So really like finding those like entry points for sustainability, finding local actors that really own the intervention and that take it forward. And that is key. So next to sharing back the research, also like as part of the program itself, the lobbying advocacy and creating local ownership was really a central part.
Great, thank you. Are there any other questions from anybody else? Eliane? I see Bahi has got dropped off. Maybe our network is not so great. So I think I'm also conscious of the time we have completely utilized, and it was a very, very provoking. We had some good discussions and very insightful study. And coming from my region was much more interesting for me as well to really learn how the countries across South Asia is really struggling and the girls are struggling with this thing. I find many takeaways from your thing, and looking forward to reread now your report. Now I know that how you have presented and what are the kind of things that have been there. And maybe I'll come back to you. I have now your emails with any other questions that you have that I may come up. And we have recorded this presentation, and I hope if Bahi had mentioned to you that this would be then further utilized to put up a webinar for the gender and COVID subgroup, that we are part of a subgroup to more disseminate informations across that. What are the kind of solutions? What are the kind of issues that people are struggling with, gender and COVID and the child marriage thing across the world? So of course, we will keep you posted that how this video is further getting utilized as well.
Thank you for having us.
Yes,
Yeah, thank you very much.
Thanks a lot. And wish you a very good day and good afternoon, wherever you are. So thank you.
But thanks, Marike,
Thank you.
for presenting.
Thank you.
Thank you all.
Thanks for hosting us. Yeah.
Yeah.
Bye-bye.
Bye-bye.
Bye-bye.